So talking about neglect, I was working most recently before joining East London in North London in Haringey, where we see a lot of children for non-acute medicals where there's concerns about neglect. So this is something that's been of interest. What I'd like to cover today is help you to understand what neglect is, what the definitions we work with in this country. Hopefully allow you to get you to understand quite how prevalent neglect is in our community, and what impact that has on children and young people. And then for you to think about settings where you need to recognize neglect, whether it be in the A&E, in the community, or in your general clinic. And then thinking about what things that you can do as a pediatrician, as a practitioner, to advocate for these children, to communicate your concerns with social care, etc. So hopefully you will come across the Working Together document, which put together the government for a multi-agency document for which we should all be working from, sort of our guidance. And this, in the UK, neglect is defined as a persistent failure to meet a child's basic physical or emotional needs, and this is likely to result in a serious impairment of the child's health or development. So we're thinking of something that's happening perhaps over a long time, and something very basic that this child, that this fundamentally needs. In terms of the persistence, it's of interest that in Wales and Northern Ireland they've actually removed that word persistent, because there can be perhaps significant episodes that occur where in of itself would be quite serious, and you want to. Sorry, I will speak up. Can you hear me? In of itself would raise safeguarding concerns. Thank you. So I'd like for all of you to just have a look at these very short cases. Somebody's mentioning to me that the sound is low. Is that correct for everybody, or is that just for Heba? Can you hear me?
It's fine.
It's fine.
Yeah, the sound is fine.
Okay. Heba, perhaps you need to modify something on the device that you're using. So if you all have a look at these short cases, I've intentionally not put all of the information there, obviously, but just thinking about your gut feeling, you've probably seen these cases before, in your experiences, probably not unusual, but just have a quick think for a minute or so. You can put any comments or questions in the chat box here, or unmute yourself. First one, not neglect. Ruthie, why do you think that the first one might not be neglect?
I think it might be just a once-off during the exams.
Yeah. So let's go. We'll go through one. Yeah. So it's probably quite common that a teenager coming, yeah. Or I think the teenager getting drunk, it's quite common. You probably see it quite often in A&E. But I guess thinking, yeah, you need a bit more further exploration, Sarah's saying here. I think all of these could be something neglected, depend on the context. Correct, Rachel, thank you. So let me just go through them. So the 15-year-old being found drunk in the street. So I guess the background to this, the parents didn't want to know, they'd been out, they wouldn't come to A&E to pick him up. So this is a bit more, and the fact is he's been found on the street. So who was he with? Is he on his own? This is quite risky behaviour, and what's led him to do this? is this just that he's having friends, he was in a safe environment and he was on his way home, or is this something else? And he's, at the end of it, he's quite vulnerable, and he's got very drunk in order to come on to end up in A&E and on his own. So I would be concerned. So this 4-year-old with presenting to your general outpatients. So yes, I think you'd be thinking, is this a medical reason, or is he bleeding? I mean, I intentionally said a general clinic, so it's not something acute. So perhaps, so in this, for example, in this context, this family are asylum-seeking family, and it's the first time they were seeing a health practitioner in this country. So this could still be neglect, but obviously there are other, there can be other explanations for why. I think another, as the 10-year-old asthma, you've probably seen this many, many times, and you probably many of you re-prescribed the inhalers, make sure the GP follows up, maybe you ask an asthma nurse to follow up. I think just thinking next time, when you're seeing these children acutely, why have they not been seen? Why have they not had an asthma review? Digging around, getting some more information. What's happening with school? What's happening at home? And each one of the, again, thinking neglect. So the 5-year-old with a low weight on a 0.4 centile, maybe just a failure to thrive. What's going on? Is this something genetic? Is this something medical? So this is a case that I saw some time ago when I was an ST4. This young girl was referred. She was dirty. She had really bad teeth. She was still in nappies. And when I was sitting there, the child came and sat on my lap and gave me a cuddle, and which was a very inappropriate thing for a 5-year-old really to do. Suggesting there's some inappropriate attachment. So again, something just as simple as a failure to thrive, again, be thinking, not just the medical reasons, can this be safeguarding, is this neglect? And then the last one, I think this is based on another case, but this is a child that I've seen in care. He's got stuck between a radiator with significant burns, and yes, sometimes children roll, sometimes but if for it to have taken that long and for him to sustain such significant burns, suggests that there's neglect there. And digging down at what happened, there'd been a delay as well for the ambulance to be called. So looking at the different types of neglect, we've covered quite a few of those in the cases, but there are various types of neglect. So there's education, which we talked about, not providing education, which is a basic requirement, providing emotional care. So the one that we're probably going to be more concerned with, or we might see more often, is the medical neglect, not attending to medical illnesses. And we mentioned about the supervision. So this is just very quickly what the different types of neglect. So how often do these things actually occur in the population? So Public Health England had a look at some of the things that they record, and actually it's quite common for children to not get their immunizations. We know that that's not always what we call in a safeguarding sense neglect, but we could call it medical neglect of a different kind. It's quite often that children are absent from school, so sort of up to 10%. Something that you might see is children who've got such bad teeth that they're needing to be hospitalized to have their teeth extracted, and that's really quite significant. And any child that presents like that, I think it's a warning sign. It doesn't happen very often, and you must be thinking about neglect in those circumstances. Oral health is quite a good indicator for neglect. So an NSPCC survey has suggested that almost that 1 in 10 children in the UK have experienced neglect, and of all of the of all the different types of abuse, the neglect is the one that says the main reason for which children are on a plan. So almost 50% last year of children on a child protection plan were in the category of neglect. And the actual numbers of children on plans for neglect has been increasing over the last few years. So the figures that I have, from 2018, it's almost over 20,000 children on plans for neglect. So this is very common. And something I had a look at the serious case review. So if you don't know what is the serious case review, so these are children that have been known for there to be child protection concerns, and there's been an extreme outcome, for example, that there's been a near miss or the child has died. And these are reviewed every 3 years. And looking at the most recent review that was done in 2017, neglect featured in almost 3/4 of all of the serious case reviews, both fatal and non-fatal. And in the serious harm cases, 1/5 of them, this was the primary issue. So, and neglect doesn't exist on its own. It's obviously there's the physical abuse cases, emotional cases. You will also there's highly likely that neglect is part of those lives. So I think I hope this illustrates to you that this is really not only is it prevalent, but it's also having significant impact with many children dying. So why do you think children are neglected? So in some cases it might be intentional, though perhaps not commonly. And there are lots of circumstances that this child's life which put them at increased risk of neglect. So again, looking at this review of the serious case reviews, the things that came up time and time again were poverty, mental health issues, and domestic abuse. And in many cases, these factors were overlapping. So these families have chaotic lifestyles, they can't manage their own health, and this is having an impact on how they prioritize their children. So I don't know if any of you have come across the Adverse Childhood Experiences paper. So this is a study that's looked at the experiences of children, negative experiences of children, and the ones that they looked at specifically are the ones on the in the image here. So sort of 3 direct and the others are indirect experiences, and neglect is one of them. And what the paper shows is that if a child or young person has experiences this in their early childhood, this has an effect on their mental and physical well-being going forward. And not only that, if you have more than one of these what we call ACEs, they have a cumulative impact on the family. So the way that you may have seen this pyramid before is it's felt that these adverse childhood experiences, so this is kind of the pathway where it can lead to these negative outcomes, is that they've got a disruption in their development, in their how they form relationships with others. Then they're more likely to adopt more risky behaviors, perhaps smoking, drinking, more likely to be obese. And this is leading them to be more likely to proceed to have either mental illness or chronic physical illnesses. So it's a very morbid pyramid. So but I hope it shows you that neglect is one of these ACEs, and we already just showed that in a lot of these families there is domestic abuse, there may be mental illness, there may be dysfunction within the family. So actually a child who's been neglected may already have 2 or 3 of these ACEs and be more likely to go on to have significant consequences. So these pictures are taken from the CDC website, which you can put all the resources at the end, and you can have a look at what ACEs are. You can do your own ACEs score. And these are some of the long-term effects that are related to ACEs. So going from the mental illness, as we've suggested, but also unintended pregnancy and trauma and things like that. So it's really very worrying. So the impact of neglect is far-reaching, and therefore it's really important that we recognise these things early, and we're able to support the child family as early as possible. So it's it is actually shown that neglect can affect brain development in young children, and it has a cumulative effect over the life course, and it's been related to post-traumatic stress disorder, ADHD, panic disorder. So these teenagers that we're seeing, perhaps older, with problem behaviors, challenging behaviors, have diagnosed with neurodevelopmental conditions. We just need to take a step back. Why is this happening for this child? What's happening in this child's life before now? So this is the picture that's shown quite a lot on sort of MRI scan of a child who's been neglected, and has a smaller head, and is less brain volume. So this has quite significant impact. So a place to look for the current evidence base on what neglect can do for a child and young people is the Royal College of Pediatrics, the Child Protection Evidence Systematic Reviews. So if you just type in child protection and RCPCH and neglect, you can read through the reviews, and we're just doing a new one at the moment. And so I think we know that what happens in young children who've been neglected is they're at this high stress level, and what's called it's termed a toxic stress, and this is having impacts on how they're developing neuronal connections. And so the case I mentioned earlier, the 5-year-old who came and sat on my lap, so that would be an example of a disordered attachment. You might see in a young child who's not able to form that close relationship with their parent or caregiver because of their inability to show affection or respond to their needs emotionally. So these children present with low self-esteem. They may have difficulty making friends. These are the kids at 3, 4. The parents are saying, or schools are saying, they're really disruptive. They're not paying attention in class, and so we instantly start thinking, is this autism? This is just a naughty child. But actually, what's happening at home? Is there neglect happening? And in the slightly longer term, older children, this is very common, and looking at the serious case reviews, you can see that this is happening over and over. There's children who are self-harming, who are low, unable to manage their emotions. These are very vulnerable kids that perhaps then are seeking affection, are seeking support in other areas. For example, in London, joining a gang, perhaps having substance misuse, and as well as all of the physical problems. Does anyone have any questions or comments to make on that? Any experiences of this, of cases that they've seen that they want to discuss? I'd love to interact with some of you if you're able to. All right. Well, please do interrupt me if you've got any comments or... Oh, sorry that I'm losing sound. Okay. So yes, so there's, I think a lot of the damage for the neglect is felt to be done in the very early. So the question I've got here is development catch-up possible and are there age cutoffs? So there's very little research in neglect, and I have been looking. So there is some evidence that getting involved early and helping parents with that attachment does help with that those emotional regulation and those behaviors as they grow older. So that having intensive parenting support. So I know some places have these kind of parent interaction. I think it's the Whittington has the PIP program for families where there's concerns about neglect or the attachment between children. So yes, there's a lot of evidence also that children who've been adopted and are then removed from that harmful environment will do improve and do get better. How can we differentiate between attention and focus deficit? I think it's a tough one. I think they may be coexistent. I think it's a really difficult one. It's something we have to work very closely with our partners and CAMS. And this is where having joint assessments of young people is really, really important. And I think the psychologists are better at this. Would refusal of vitamin K IMS for babies raise concerns for neglect? Well, that's an interesting question. Love for other people in the group to contribute. People want to unmute themselves. What do you think? Yeah.
What I want to say is, I guess it's like any medical intervention that we want to suggest, and if the parents disagree, where do you draw the line of that's neglect or that's just a fair enough or an acceptable parental opinion, and there's no other concerns? And I guess it depends on everything else that that you gather from the assessments.
Exactly. Yeah, exactly. I don't know who that was speaking, but thank you. I think you're right. It's within the context. You know, we feel that immunizations are the best. You know, I would feel that immunizations are non-negotiable, but not all parents feel this way, and they do have the right to make choices for their children. But if it's in the context of other harmful decision making for this child, then yeah, it's a question. I think it would be I think there's difference between choosing to refusing immunizations and those who have missed, which I think Sarah W has written here. So I think it needs exploring. And then somebody's put, what's worse, neglect or foster care? I think that's a really tough one to answer. I think it depends again on the case and the circumstances for that family and why the concerns. Exactly. Thanks, Alice. Informed choices versus lack of education, care, and neglect. Exactly. So I'm getting distracted by this chat box. I think I've got to answer one question at a time. So I'll start with the presentation of, you know, for the immunizations discussion. I think it will depend on context, it depends on the family, it depends on the reasons. Why are they making an informed choice? Are there other concerns? So this is where your role would be to explore further, check in with the health visitor, the GP, school. Thanks, Christine. So then we're talking about what's the difference between foster care and neglect. There's a really interesting discussion happening in the chat box if everyone is having a look. So there's two issues here. One is about whether being in care, the outcomes for children are better or worse than staying in a neglected environment. I think, again, it's in some cases where there's been extreme neglect, has been a lot of positive impact by that child being removed from that situation. I'm not aware of the study that Christine is talking about. Perhaps you can put the link in the chat box, Christine. That would be really helpful. Thank you. That's okay. And then Rachel's asking if we're seeing a lot more delayed presentation. Alice, do you want to unmute yourself and talk? Might be easier.
Sorry, Sveta, I'm just answering some of getting involved in some of the chats here.
Yeah.
Totally agree with, I mean, that the study on foster care, and I, from just experience, I suppose, of looked after children, I do believe that there's a lot of positive impact that can be made from a proper professional parent, and a lot of catch up on developmental delays, whether they are coincidental, as you mentioned, with neurodevelopmental disorders anyway.
Yeah.
Probably, possibly, likely, but it's the the functional need of the child at the end of the day.
But there's also a lot to be said for giving parental support, because a lot of the neglect, depending on the circumstances of the case, obviously, if there's parental mental health issues, if there's attachment difficulties, if parents are supported with intensive support, there's a lot of improvement that can be made without requiring foster care. But it just depends on, I guess, locally the support that's available is a big factor, but also the circumstances of that child. What other unmet needs do they have? So I'm just going to carry on, if that's okay, and we can have some more of this discussion as we go on. So the way thinking about neglect in sort of the health context, so we've talked about some of these things, is they can have a direct impact. So there can be an unrecognized need. So with children who have eczema, perhaps, and have not been treated, so parents just haven't recognized that that's what's going on, haven't gone to the GP to get appropriate treatment, missing screening appointments or missing immunizations we were discussing, or not responding to signs such as, quite commonly we see children who've got significant speech delay, and that's something that's picked up on the child protection reviews, that having speech delay is a common feature of preschool children who've been neglected. The other thing is having an unmet need, so they have a medical condition and children are not being brought. So that case I talked about earlier about asthma, and this being not brought, I think this is a really significant issue with it, and this is something we can all be aware of and do more. And then there's sort of the risk due to poor supervision. So this is a case we saw in Haringey. So the 6-year-old girl who'd moved into the UK when she was 2. They'd been moving around from school to school, different boroughs, reported to have behavioural problems. Schools reported that she's been really frustrated in school. School thought that she may not be able to hear, so they referred her to the GP, who was then sent to audiology and was not brought and was discharged from audiology. So what do you think about this family already? What are you worried, and what are the sort of red flags in this case?
Well, there's lots of red flags. First, that she is having ongoing needs that seem to be unmet. Parents are moving several times. There's no continuity of care. She's missed one further appointment that was meant to try and help her. So there's lots of things that sort of raise red flags with her. And she's 6 already, so it's been something that's been going on for quite a long time.
Yeah. Thanks, Sarah. So actually they came to the pediatric clinic because the school nurse was worried, and she wasn't able to hear. The audiology did see in the end, and she had severe bilateral hearing loss. So how did that happen? Like what could we have done better in this instance? So there's language barriers for this child. Could we have advocated for this family better? I think Harry's mentioned about who's advocating for her. Had interpreters. We don't know the conversation the GP had. Did they know how important it was to attend that audiology appointment? This issue of was not brought and then being discharged, I think, is a really difficult one. I know there are a lot of pressures on waiting lists and things in in hospitals, and it's only going to increase post COVID. I think we need. Hello. Okay, don't know. Somebody came off mute. And so what's the follow-up for that? There was this concern, lack of parental understanding, and there's was that followed up by the GP? Was that followed up with the audiology team? How can we better communicate in these circumstances? So I think these are very valid points I can see being put into the chat box. We should be doing better about how we communicate with parents, particularly if they don't speak English. And so this perhaps there's some neglect, but also I think there's a lot of professional responsibility here for this child and this family, and we need to just be aware, because this has probably had significant impact on this child's ability to learn, her language development, etc. So it's really, it's really difficult to respond to neglect, I think, because it's not like with physical abuse or there's a clear event. You see a bruise, you meet a threshold. So it's very hard to meet this threshold. How do you communicate to social care there's something not right? And they've just not come to appointments. And sometimes there can also be this thing called disguised compliance. I don't know if you've come across this, but people, professionals get concerned. There's perhaps they've raised things with the family, and then they will attend. They'll suddenly attend appointments. But just by attending doesn't mean they're necessarily complying with the advice or the recommendation. So you just need to be careful. And you may have a relationship with the family that that either positive or negative, that makes it hard for you to respond. So perhaps it's a very quite often an aggressive parent, and it's quite challenging to engage the family. So I'm just going to have a quick look. There's a few questions in here. There was a plan for vulnerable children to have access to educational settings during lockdown. We know that national uptake is poor. Should this? Yeah, I think it should play the factor in our assessment. This child presented for medical issues that may have been avoided if they were at school, e.g. a burn or unsupervised fall. Yeah, so I think it's I think for a vulnerable child, I think the advice is that they should be attending school, and I know from speaking to colleagues in education that they are keeping communication open with those children calling in, and are aware of where those vulnerable children are. And I think if you are concerned, definitely it should factor into your assessment of this child. When would you consider referral to social services if a child was not brought to an appointment and then you can't get hold of family? So I think you need to explore that a bit further. Is this the first time they're coming? What's the nature of the issue that they're coming for? Again, are there language issues? Have we tried everything to get this family to engage? Can you get think about who's in your team? Can you get the health visitor to pop round if they're under 5? Can they have a conversation with the family? Can get the school nurse perhaps to follow up for you? Have there been social concerns in the past? Can you write to the GP and say that you're worried that this child has missed these appointments and it's quite significant, and see if they can follow up? So I think I guess this is sort of the questions you're all asking, is kind of thinking about this child, what is life like for this child? What is happening at home? What is happening with their education? Do we know? So going back to Adib's statement, if the parent had mental health concerns, there's a history of domestic violence, they're in extreme poverty, the child's not been attending school. I think in all of that, you want to bring together all of that information. Think about the threshold. So there's things that are available. There's something called a neglect tool that you may want to use that helps you to grade your concerns. And I know in some boroughs, the health visitors and sometimes social workers have that tool, and they can use that as a guide. Obviously, it's just a guide. Just because the tool says it's not a concern doesn't mean you shouldn't still refer, but it may support or help. And somebody mentioned earlier in the chat box that thinking about a chronology, so listing out the different how many times, sometimes having a date order, like actually listing out the number of times the child was not brought, number of times you weren't able to contact them. So every time you've tried to call them, I would make sure you document it somewhere and say you tried to call and weren't able to get through. Make sure you're following up if you've made a referral. So we need to be able to demonstrate that we've done everything that we can to help this family and this child engage with us. And if we can show that we've done everything and they're still not engaging, then that helps to raise that communication with the multi-agency team. The other thing is just thinking about the older cohort. When you're seeing young people in A&E, don't forget to use that HEADS assessment. It's an opportunity to ask about whether there's been neglect in the family, throughout their childhood. That's another, just thinking about what their risky behaviours and what may have contributed. I think that's an opportunity for us to think about what's been happening for this child at home. So as we've mentioned, if you want to bring that information together, another thing that we use quite frequently in the community, and perhaps we don't do as often in the hospital, is having a team around the child or a professionals meeting where you have concerns about neglect and you bring in all of the professionals, including from school and social care, to think about the concerns for this family. And that in that joint communication, often it does become very obvious that actually that there should be more done for this child and there needs to be action taken from a child protection point of view. So it's just an example of...
Sorry, can you hear me? It's Adib. I just wanted to interrupt again, if that's okay, just to ask a little bit more about that was not brought question that I raised. So my question isn't really regarding things that are medical emergencies. So my question is, if you're in an isolated clinic and you've seen, and a patient wasn't brought, and you've made all the attempts you can to try and call and follow up, is there a point at which you just let the social services know that the child wasn't brought to clinic, because it helps paint a picture of what's going on potentially? Because I'm thinking about if a child comes to A&E and say something happens, we would often call social services just to let them know that the child has come in and it's been a simple trauma, and we haven't got any concerns, or to know if they are known to social services. We don't tend to do that in an outpatient setting. Is that, I mean, do you think that's over the top, calling them, even just to keep them in the loop, or not?
So I guess I'll have to see what others do, but it depends on your level of concern, really. I guess, again, I think there's no harm. I'm not sure how they will respond, but if you're wondering, if you don't have any previous social background on this family and you are worried that this family haven't come, then I would never say no. They're only going to say, fine, thanks for letting us know. But I don't think there's anything, if you've got the time, I think that's the right thing to be doing, particularly if you're worried about a family. I just wonder what that threshold should be. As we've said, there are lots of reasons why children aren't brought to appointments. Not always just neglect, but I think it's important to be thinking about it. I think I mean, I think about, because I'm interested in safeguarding, I think about neglect all the time, and so perhaps my threshold is lower. So let me see what's happening in the chat box. Is this contributing to this discussion?
Thanks, that's really helpful. Thank you.
We should be including our concerns about safeguarding in any referrals. This will help making decisions about discharging back when not brought to clinic. Yeah, thank you, Julia. Yeah, I don't know about others who are doing outpatient clinics, what your practice is, what your threshold is for calling social care. Perhaps those on the call are more likely to have that conversation. I think it's a good question. You're right. We're very quick to do that in A&E, and we perhaps don't do that as much in outpatients. We can check local records. We should have those who've had social care involvement should be flagged up on our system, or held in it with the safeguarding lead in your trust. So that might be a way of doing it before directly calling social care. Alice, Sarah, anything? No.
Sorry, just had to unmute myself. Yeah, no, absolutely. Usually in an outpatient setting, you have a policy anyway about sort of the number of DNAs before you're discharging at any point. I guess, so I'm used to working in settings that are relatively high rates of DNAs, but also high rates of safeguarding. So we would involve our safeguarding nurses at the trust quite often before we make the decision to discharge, ask them for information if they've got anything on, if they know the family at all, or to look into it a bit further for us before discharging from, say, the ADHD service, where we know that there's high rates of both. Yeah, I think as soon as I basically think as soon as if that thought's come into the back of your head that there's concerns, then you need to start triangulating your information and involving other professionals. And I don't think it ever does any harm to share a concern.
Yeah. Thanks, Alice. So the other piece I think about what else we can do is I think how can we help support this family? I think particularly now there are families who are struggling financially, needing more support from their communities. So thinking about how else you can support this family, pointing them towards resources in the community, I think would be really important. And then don't forget the child's voice, and I think Najette's going to be speaking to you tomorrow morning in a bit more detail about the child's voice and how we can represent this in the assessments that we're doing. But what is life like for this child? In this family? And I think if you put them at the center of your decision making, that will automatically help you with those conversations. And when if you think that threshold's being met. And this is just something from the NICE guidance on safeguarding, and there's some of the interventions that they've recommended that can be implemented in families where there's been neglect, and these are sort of evidence-based. So someone was asking before about what interventions can do and what impact they could have. So I'd suggest just having a look further on the NICE guidance, but these are some of the therapeutic interventions that can be offered from our colleagues in CAMS in terms of parenting and attachment-based intervention. So that's me done. Finished a little early, so perhaps we could follow through on some of these conversations we have. I think Dr. Jalobi is useful to explain to social care the impact of non-attended appointments, otherwise they fail to understand the concern. So I think going back to that, and thanks, Ayanda, the thing goes back to that initial definition about what's causing significant harm. So if you can illustrate in your assessment that by not bringing a child, for example, for an asthma review on X number of occasions and not filling out a prescription for the inhalers, this can have significant effect on the respiratory health for this child. They're more likely to have more, increased attendances to hospital with exacerbations of wheeze. They're less likely to attend education, and this is going to have both a physical and emotional impact on this child. So making that argument when you're writing that referral can be quite strong. And if you're able to attend the child protection conference or the child in need meeting and put that, I found that very effective in the past, being able to, you know, to say that they can't ignore that then, that's something, you know, that something has to be done. And they do respect it coming, you know, from a medical professional. So I think that's a really important role that we have in being able to communicate those concerns and the potential harm it can have for a child.
Sweta, I just had a question. I was wondering if you know if any sort of early intervention things are somewhat ongoing in the current situation we're in. Most of these cases probably need a lot of early intervention and parental support. And I'm just wondering what form that's taking right now, or if any of it is continuing, and if you know.
Locally, I know that CAMS are still very much involved with families, and a lot of what they can do, they're able to do virtually. But that would be my experience, mainly for the sort of the looked after children that I work with and the slightly older cohort. For the early, for the under fives, again, I think they are still involved. I think we're still doing quite a number of virtual consultations and telephone conversations, and I know that the IAP service and talking therapies are still very much in contact with families, but that's in UM. So I don't know about other boroughs, if anyone can contribute what's happening locally to them. I don't know. There's lots of discussion on sort of national safeguarding forums that seem to be mindful of that. And I think everything's being done to try and maintain contact, albeit virtually and not face to face. Anybody have a different experience? No. So just sort of to summarize, you know, I hope you are now aware that neglect is very common, if you and that an increasing number of children are on child protection plans for neglect. Neglect can have a significant impact on brain development. Neglect is one of these adverse childhood experiences, which again can affect emotional, physical well-being. And that, you know, we might think about, when we think about medical neglect in our settings, this might be as a result of an unrecognized or unmet need or poor supervision. Please remember to think about neglect in all of your consultations and follow through on the referrals and frequent was not brought. Use those tools, talk to your colleagues in the community and in the GP surgeries. Share information, don't forget the child's voice, and it's really important to act early and advocate for support for these families where we can. I think I can't see anybody. And I've included all the resources on my slides. So when they get uploaded, wherever they get uploaded, they'll be available. Hi, Sarah.
Thanks, Sweta, that's really great. Everyone, can you all remember, please, to fill in the feedback form for Sweta, and also continue to attend all this week. This is to replace the Safeguarding RSM day we had for next week, and it's a great program planned, so keep on attending. Bye.
Stop recording.